بسم الله الرحمن الرحيم. نكمل موضوع local anesthesia لهذا اليوم محاضرة. نتطرق بمحاضرة local anesthesia حول أهم مشاكل local anesthesia. The complications of local anesthesia. Before we start with the complication, we must give some notes about each dentist dealing with local anesthesia should be known. The possible complication of local anesthesia. يجب معرفة كل ما يتعلق بالcomplication قبل ما نبدي نعطي local anesthesia to the patient. Second, the preventive measures of these complications. كيف نتجنب أن تحدث هالcomplication للمريض. Third, the treatment possibilities of this complication. وكيف أنه نسوي علاج لهالcomplication. إذن من خلال معرفتنا للcomplication يجب أن نعرف كيف نعالج هذه complications. We classified the local anesthesia complication two categories. First, local complication and second, systemic complication. The local complication occurred in the region of the injection of local anesthetic solution. The systemic complication occurred in other part of the body. So all parts, not only the area that giving the local anesthetic solution that affect by this anesthesia. Start with the local complication. That means the complication occur in the side that give you a local anesthetic solution. The most common local anesthetic complications is failure to obtain anesthesia. رغم انه تعطي local anesthesia بس ما راح تصير الانستيزيا الكافية. The anatomical reasons that first etiological factor that lead to failure of local anesthesia. What's the anatomical causes of failure? First, axillary nerve supply. There are more than one nerve. It's like the central incisor and upper from the other side can give innervation, or at the between the canine and premolar that can give an innervation from anterior superior and from middle superior. So when you can give anesthesia and there are no any response, the other nerve you must give anesthesia. The second anatomical reasons, abnormal course of the nerve. The nerve, if you have higher or lower or anterior or posterior to its normal location, so maybe not have enough local anesthetic solution go and lead to have a failure of local anesthesia. The third cause, thick cortical plate of mandibular process preclude infiltration of anesthesia, and therefore infiltration anesthesia is insufficient in lower jaw. If the thickness of the mandible is more than normal, so there are not enough local anesthetic solution to give anesthesia. Fourth cause, variation in the foramen location, and mainly the mental foramen and mandibular foramen. If the patient have edentulous or dentulous, and if the retained edentulous, so its location differ from each condition. The last cause of anatomical reason, sometimes the teeth can be innervated by more than one nerve. The other pathological factor is the pathological reasons. These causes lead to failure of local anesthesia, like trismus, limited mouth opening. The contraction of muscle of mastication, it calls trismus. So cannot give local anesthesia, mainly block for inferior in good technique. Second cause of its infection and inflammation. We know that local anesthetic drugs need alkaline media. When the infection and formation of pus that lead to acid media. So the failure of local anesthesia due to presence of pus within the area of local anesthesia. The last pathological causes, previous surgery or trauma to the early area that work mainly in infiltration technique. The other causes of failure of local anesthesia, psychological reasons. The fear and anxiety can cause failure in local anesthesia. بما أنه نعرف أنه أكثر المرضى عندهم خوف من طبيب الأسنان، فلهذا أحيانا أنه يحس بالlocal anesthetic occur in his body. So before we start any giving local anesthesia, the relaxation of patient is needed. For this cause, the use of a sedative agent like benzodiazepine may be helpful. في حالة إنه psychological upset and have the failure of local anesthesia, we give the sedation by Valium. The last cause of failure of anesthesia that deal with the dentist himself or herself via faulty technique. First, an adequate amount of local anesthetic solution being deposited in close proximity to the nerve. Second, injection in blood vessel. Third, injection of local anesthetic solution away from nerve and mainly if anatomical variation is present. And when use of solution after the expiration data, expiratory data recommended by the manufacturer. The last faulty technique, very rarely patients are seen who appear to exhibit an individual resistance to the effect of certain drug. حقيقة اختار لك المريض إنه هذا الدواء ما يفيدني أو أبرة واحدة ما تفيدني، فهذا تؤدي إلى failure of local anesthetic solution. Now, after finish the failure of local anesthetic solution and is treated by re-injectable for the correct area and correct technique that given to the patient. The pain during and after injection. Pain on deposition of local anesthetic can best be prevented through careful adherence to the basic protocol of automatic injection. حقيقة إذا كانت الneedle not sharp that lead to tear wide area and lead to have severe pain occur. The etiologic factor for this condition is psychological reason, the sharpness of needle, fast injection under high pressure, aggressive insertion of the needle, low pH value, mean acidic pH, other measures which minimize discomfort, and incorrect injection site that leads pain during injection. Other complication, that collection of blood within the soft tissue, call it hematoma. So the hematoma formation on the oral cavity injection. We have many venous plexus within the area of mouth and face. The most dangerous venous plexus is the pterygoid venous plexus, infraorbital venous plexus, the inferior lunar vessel in the pterygomandibular space, posterior superior vessels, the mental vessels that if any injury to this vessel lead to a collection of blood within the soft tissue. The patient should be told that the bleeding stopped spontaneously, that these swelling usually disappear within 24 to 48 hours, and discoloration disappear. If this thickness the hematoma is likely to become infected, antibiotic therapy must be initiated promptly. في حالة وجود هذه collection of blood by time it resolves, to prevent infection of this area, the give antibiotic therapy must be initiated promptly. Other complication is intravascular injection، خاصة من نعطي block anesthesia for inferior nerve or infraorbital nerve. أحيانا ندخل blood vessel and give local anesthesia. The intravascular injection of any drug increase in possible toxic effect. Other problem is bleaching. What means bleaching is ischemia is transitory and may last from 30 seconds to 30 minutes. هو حقيقة الإسكيميا هو white color of mucosa become more whiter from red to pink, and then that no treatment other than reassurance is required. حقيقة البليشنج هي تتكون نتيجة الفازوكونستركتر بكمية كبيرة في منطقة البلد that lead to stretch and reduce blood supply to this area and lead whitening of this area. Trismus. What mean trismus? Trismus means the contraction of the skeletal muscle in a very strong way. So trismus is difficulty in opening the jaw due to muscle spasm, and mainly the muscle of mastication. You have four muscle and very strong muscle that have any contraction of one or more than one group of muscle lead to trismus. The etiological factor for trismus: first, penetration of muscles by needle during administration; second, hematoma formation in the space of the muscles; infection in area close to one of the muscles of mastication that lead to difficulty in opening the mouth. There are any disease have a symptom and sign. The main symptom is limitation of movement of mandible, which is often associated with pain. Symptoms arise within 1 to 4 days of injection. How we manage it? By applying hot moist towel to the site of approximately 20 minutes every hour. Give analgesia as required. Instruct the patient to go gradually open and close mouth as psychotherapy. The other problem for muscle of mastication of the oral cavity by local anesthesia complication, facial paralysis. This complication arises if the tip of needle is inserted too far back and behind the accessory ascending ramus. The solution is then deposited in substance of parotid gland where it is anesthetized the branches of facial nerve causing paralysis of muscle they supply. If the nerve supply to the eyelid has been affected, it is wise precaution to close the lid and apply protective pad or eye shield. حقيقة إذا صار في contraction, relaxation of muscles that control the opening of upper and lower eye, you must is wise precaution to close the lid and apply protective pad or eye shade. Other complication هي prolonged impairment of the sensation. حقيقة الإنسان طول فترة التخدير هذه واحدة من مشاكل local anesthesia. Some term you must know it before starting a local anesthesia. First, anesthesia. What means anesthesia? It's total loss of sensation. Second, paresthesia is an altered sensation characterized by burning, tingling, pricking sensation experienced by the patient. Third, diaesthesia is an abnormal, unpleasant sensation experienced by the patient in the absence of stimuli. Last one, hyperesthesia is an increased sensitivity to noxious stimuli. We have either direct trauma from the bubble of the needle or injection of anesthetic solution that is contaminated with neurotoxic substance such as alcohol, or last one, hemorrhage and infection in close proximity to the nerve. Most of these are transient and resolve within 8 weeks to 2 years, but become irreversible in rare occasion. The measurement by resonance of the patient that condition is transient, not the sign, symptom, and follow-up of patient. They refer the patient to specialist if the symptom is persistent. The other complication were broken needle. The needle now used is disposable, so there is no any problem by new modern needle. But when used stainless steel and repeat sterilization, that lead to weakness of the needle shift with the hang up and lead to fracture when giving anesthesia. This view OBG for the patient, and you can see the arrow end of the needle that go within pterygomandibular space. The causes of a broken needle: first, weakness of the metal of the needle when corrected the metal. Second, reusage of needle due to fatigue of metal. The last one, incorrect technique by aggressive insertion of the needle into the tissue, sudden change in the direction of the needle inside the tissue, too deep penetration. The needle should never be embedded completely to the hub within the tissue, but at least 5 mm must project from the mucosal surface, so might be fracture at this point. And other causes, sudden movement of the patient or practitioner. The last cause is manufacturing defect that lead to broken needle. If a fragment of needle is returned within the tissue, you must treat it as follows. The patient should be informed and the situation explained to him. Radiograph should be taken to confirm its presence and position. Refer the patient to oral and maxillofacial surgeon to remove the fragment and ترجع anesthesia. في حالة كسر النيدل بالsoft tissue خاصة تريجو بلاتاين سبيس صعب أن تخدر إلا تخدير عام، كان نعطي التخدير for the patient. The other cause, infection, but if the needle has been contaminated prior to insertion, the infection will likely manifest as pain and trismus 1 day after injection. If this symptom persists for days, so much give the patient antibiotic treatment. The rare cause occurred to the child is trauma. After give block anesthesia for inferior nerve that have numbness mainly in bilateral side, this numbness occur for the patient has take this block anesthesia. So in children who have had inferior block injection should be warned that it is possible to show the anesthetist part of lower lip and so produce a very sore ulcer. In spite of this warning, the complication can occur, but fortunately such lesions heal rapidly. In adults, give an inferior block injection for the first time should be warned of the risk of thermal damage to the lower lip from either hot drink or cigarette smoker. The other problem is very, very rare is visual disturbance. On very rare occasion, patients complain of unilateral or bilateral disturbance of vision as aqueous, sequent or double vision, and even transient blindness has been reported. An adequate explanation is now, but vascular spasm or accidental intra-arterial injection is most likely causes. The reassured that normal vision will be restored within about 30 minutes and can return the vision correct. Now, after finishing the local complication, we go to other categories is systemic complications. The first systemic complication, as most common complication occur in dentistry, is fainting, other term vasovagal attack. Vasovagal attacks is a reflex of nervous system that cause heart to slow down bradycardia, at the same time affect the nerve to blood vessel in the legs, permits this vessel to dilate. As a result of heart eject less blood so the blood pressure drop, the fainting episode occurs. In attempt to redistribute the blood to visual organ. The most important predisposing factor to vasovagal attack are pain and anxiety. The fear from the injection of the dental needle that lead to some fainting of the patient. The patient often complains of the following symptoms. First, dizziness, weakness, and nausea. And following sign. The skin is pale immediately before the collapse, cold skin, clammy skin, weak and slow pulse. When treated this condition as fainting or vasovagal attack, the head should be lowered quickly by adjusting the back of the dental chair so that the patient assumes in supine position with leg elevated. حقيقة أي حالة fainting يوضع in supine position وترفع leg upward to return the blood to the heart and can go return consciousness of patient. Tight collar plates should be loosened and respiration is stimulated, spontaneously recover as usual. حقيقة أي شيء يربط الجسم يجب أن يحل ويوضع في السوبان بوزيشن ويرجع خلال فترة قصيرة. If signs of recovery are not apparent within 30 to 45 seconds of the first aid measure, the collapse probably is not vasovagal attack, and this is case medical emergency team should be asked immediately for help. Other complication, drug interaction. In patients under tricyclic antidepressant drug, variable drug of potentiating of blood pressure response to catecholamine, adrenaline, and noradrenaline will occur even to small doses. The other complication, sensitivity reaction, mean like allergy. This phenomenon occurs due to sensitivity of some individual to certain substance known as allergen. So هي نوع من أنواع الحساسية. وحقيقة أي material تدخل ويا local anesthetic solution تؤدينا إلى الالرجي like local anesthetic agent, vasoconstrictor, and additive like bisulfate which used as a preservative. Many of complications suspected to be allergic are actually the psychogenic reaction should caused by fear or dental treatment. The presence of adrenaline in local anesthesia solution, which can cause several general symptoms including palpitation, restlessness, and nausea, هذه أهم الأعراض التي يجب أن نلاحظها patient have allergic reaction. We have two classifications for the allergic reaction. The true allergic response to local anesthesia may be localized. The area only that give a local anesthetic solution may have allergic reaction, or generalized all body can be affected. Other classification here, either at the time of operation for immediate complication or after 2 to 3 days or more called delayed in onset. The sign and symptom of the allergic, the first mild skin irritation lead to rashes and anaphylactic reactions. The second sign and symptom is anaphylactic shock, and it is very dangerous due to enlargement of larynx and close the airway and lead to suffocation and death. These categories that have the sign of the allergy: first, profound fall in blood pressure, dyspnea and respiratory impairment, facial and laryngeal edema, loss of consciousness, and urticaria, mean itching of the skin. It is life-threatening condition since it causes airway obstruction in association with laryngeal edema unless treatment is initiated immediately. The condition may progress to fatal termination. حقيقة laryngeal edema هذه تؤدي إلى stop bleeding and is initiated immediately. The treatment plan: first, epinephrine is the most important medication for treatment of anaphylaxis. It is injection into a muscle. Epinephrine works rapidly to make blood vessels contract, preventing them from leakage more fluid, relax airway, helping individual breathe easier, relieves cramping in the GIT, stop itching, rapidly reverse the life-threatening symptom of anaphylactic shock if given time. Even if the individual responds to the epinephrine, it is virtually to go to an emergency room immediately. Second, medications to be given to improve breathing. Third, intravenous fluid may be necessary to restore adequate blood pressure. And fourth, additional medication, antihistamine to counteract the effect of histamine and to help in prevention of delayed allergic reaction. And lastly, if the victim stops breathing, perform cardiopulmonary resistance, CPR, immediately to the patient. Other complication is overdosage and toxicity. It is relatively rare a toxicity reaction can occur to the patient when the concentration of local anesthetic solution in circulation increases too rapidly within a short period of time. The toxic effect is primarily directed to the central nervous system and cardiovascular system because these tissues are composed of excitable membrane. We have other classification of overdosage, either mild overdosage or severe overdosage. We start the sign and symptom of mild overdosage. The first, restlessness, retention of consciousness, detectiveness, agitation, which may end into convulsion, along with increased blood pressure, heart rate, respiratory rate. Classified according to the onset of the anaphylactic shock. First, slow onset, and second, slower onset. The slow onset lasts have not more or equal to 5 minutes following administration of local anesthesia. The process causes rapid absorption and too large total dose. Other categories, slower onset, that have less than 15 minutes following administration of local anesthesia. The possible causes are abnormal virus transformer and renal diseases. We have steps in treatment of anaphylactic shock. The first step reassures the patient that everything will be all right. Second one, administer 0.2 IV and nasal cannula or nasal hope. 3. Monitor vital sign. 4. Administer anticonvulsant. 4. Infusion for diazepam 5 mg. The midazolam for 1 mg per minute. Step 5. Permit the patient to recover as long as necessary. The patient can leave the dental office. The dental office occurred or escorted if we believe that the full recovery has occurred. If the doubt exists regarding the level of recovery, then the other step seeks medical help, and last step, after termination of receiving the action, be assured that the patient be examined by physician to determine the causes of this reaction. We have signs and symptoms. The first one, unconsciousness with or without convulsion, vascular collapse, coma, cardiac arrest, and respiratory arrest. Classification of that first, rapid onset, second, slow onset. The rapid onset within 1 minute, the possible cause as intravenous injection. The second one, slow onset, 5 to 15 minutes, the possible causes are too large dose, rapid absorption, and abnormal biotransformation. The treatment, first, terminate dental treatment. Second, if convulsion, protect the patient arm, legs, and head, loosen the tight and clothing, and immediately seek emergency medical assistance. Step 3, provide basic life support. Of adequate airway and oxygenation are of the most importance during management of local anesthesia, including seizures. Fourth step, administer anticonvulsant with good oxygenation as acidosis not present within 2 to 3 minutes. Seizures would cause if the seizure is protected. 4 to 5 minutes within no indication of termination, that then consider administration of anticonvulsant. Step 5, post-seizure central nervous system depression is usually present and it is not intensity equal to that of excitation phase. The patient is drowsy or unconscious. Breathing may slow or absent blood pressure. Heart rate are depressed, so maintenance of patient airway and oxygen are necessary. Based administration of intravenous fluid is initial management of hypotension. And finally, allow the patient to rest until its recovery. We can do other complication, for pre-operative complication and post-operative complications. The pre-operative complications that include pain at injection, failure to obtain anesthesia, fainting, hypersensitivity to local anesthesia, overdosage, and toxicity, drug interaction, needle breakage, facial paralysis. This is with that complication occur during operation. If that occurs after operation, day to several days, called post-operative complication. That post-operative complication have hematoma, trismus infection, persist anesthesia, and serum hepatitis. Thank you for your listening for this lecture and the questions later.